Mobile clinics, while being aggressively sold to the public in Kenya between 2014 and 2015, were spoken of as a quick route to lowering child mortality and getting health services to communities that reach them. But far from being the solution they were proposed as, these clinics are at the center of procurement-related corruption scandals worth hundreds of millions of shillings. Revelations from leaked procurement data show how several companies, some linked to sitting members of parliament, got government tenders, and sheds more light on Estama Investment Limited, a company which has been on the spot for 4 years over corruption allegations. Follow us as we track down dozens of containers, about 1 billion shillings in public funds, and members of parliament linked to companies involved in betraying the promise of improved health services to Kenya's most vulnerable population. Mobile clinics are not new to Kenyans. Camel clinics in Samburu, selling doctors in Lamu, and motorbike ambulances in Murang'a counties have been in use over the years.
She's expecting her 5th baby.
Beyond Zero, Kenya's First Lady's popular initiative, has promoted both mobile and portable clinics for over 6 years. The idea was to improve maternal and child health care in the country. Officially, Beyond Zero raises funds from the public and from corporate sponsors to procure containers before handing them over to counties and NGOs to operate. However, leaked procurement data from the Kenyan Government Accounting System, IFMIS, shows that the Ministry of Health awarded a 1 billion Kenyan shilling blanket purchase agreement to Estama Investment Limited to procure clinics for Beyond Zero. There is one transaction for 1 billion and another 4 transactions that add up to another 1 billion. One of these 4 transactions was flagged as requiring approval. All of them were allocated to Estama. One transaction is described as a payout for Beyond Zero mobile clinics and the others for portable clinics for the slum upgrading project. It is unclear if the 2 contracts are related. Until now, one man has been connected to Estama Investment Limited. He is Njage Makanga, the company's director. However, data analyzed by our reporters shows that the Estama contract was first intended for Beyond Zero, and that a company in Estama's network belonged to 2 members of parliament. Another 8 companies were paid to install portable clinics, including 2 belonging to yet another member of parliament. Before the above transactions were made, Kenya's First Lady, Margaret Kenyatta, had launched the Beyond Zero initiative in January 2014, registering the charity as a private company. In July 2014, Beyond Zero sent a mobile clinic to Taita Taveta, and another 46 clinics were distributed to the rest of the counties by the end of 2016. Beyond Zero also installed 11 portable clinics in Kibera's informal settlement, 9 of which are still standing following the post-election violence of 2017 that left 2 of the containers destroyed. That project was in collaboration with the National Youth Service, as the branding on the clinics indicates. Beyond Zero's main purpose appears to be procuring portable clinics, after which county health authorities take over maintenance and operation once the clinics are delivered.
Beyond Zero is an advocacy platform. And we're just trying, at that time, we're trying to bring healthcare closer to the people. So in partnership with different organizations and counties, that's how they came to be.
Okay.
Because you can find there are different other NGOs in Nairobi with the mobile clinics. So you find it's a partnership between Beyond Zero and let's say Shofco, for example. Or you find another foundation like Aga Khan Foundation and Beyond Zero, and they have a mobile clinic.
Vile ililetwa hapa tulikuwa na furaha tukijua kwamba tutakuja kupata services kari kuliko kukimbilia mbali. Kuna some spaces kuna nafasi kidogo kidogo tungeweza kuweka hapo, hata kama si kuandikwa, kuajiriwa hapo, tufanye kibarua hapo ama kazi hapo. Tunaweza hata jiajiri wenyewe kando. Imechukua karibu miaka 5 inaelekea 6 kuanzia 2015 ingie mwezi wa pili, na imekaa tu hivyo, ijawahi function. Sasa tunashindwanga, tunasikianga pesa za kazi fulani, tuseme kama si, kwa mfano tukiangalia nje imeandikwa NYS, in full National Youth Service. Sasa tunashindwanga. Hii ni baadhi ya zile pesa tulisikianga za kazi kama hizo zimekuliwa ama ni nini. Sasa tujui.
For this, the First Lady has promoted high-profile fundraising events and attracted high-profile corporate sponsors. But the leaked data set shows that the initiative has also benefited from public funding, including the presidency and the Ministry of Health. Let's go back to the Estama and Beyond Zero relationship. One procurement contract in the IFMIS database with the order date of 10th June 2015 shows a Ministry of Health agreement to procure 100 portable clinics for a total of 1 billion shillings, 4 Beyond Zero. The company listed as the supplier on that contract is Estama Investment Limited. Another contract for Estama was entered into the procurement system after 7 days, this time for 20 portable clinics for Beyond Zero and showing an amount of 0. The then obscure company became a major news headline after the Afya House scandal came to light in 2016. 1 billion of that was money for the 100 portable clinics to be supplied by Estama, meaning each container had been valued at a whopping 10 million shillings. The EACC began investigations under suspicion that the price was inflated, and consequently in 2018 froze accounts associated with Estama and its director Njage Makanga. 99 containers were delivered to the NYS yard in Miritini, Mombasa, and on several occasions inspected by members of parliament. Endebess MP, Dr. Robert Pukose, was one of the MPs who inspected the containers. Pukose's estimates on the cost of the containers further reaffirms that they were indeed overpriced.
When you do the prefabrication, it should not go beyond even 500,000.
Yes.
But when you find somebody quoting huge figures,
upwards of 10 million shillings, yeah.
Yeah, to a 10 million something. When you buy the container,
yes,
you normally go to these yards where they sell those containers. You'll find that the price is actually around 200,000.
Yeah.
Or if it is very high, 250 up to even 300.
Satellite images show that the clinic sat at Miritini for about 3 years as the investigation dragged on. According to corruption expert John Githongo, this level of embezzlement could not have happened without support.
On the issue of Estama portable clinics and that investigation, it is totally out of the question that they would get the contract without the involvement or assistance of a public official. That just doesn't work like that in Kenya.
Njage Makanga, the only name on the spot up to this point, is listed as director to at least a dozen companies. Those companies lead to more companies, revealing a sprawling network. In a phone interview with one of our reporters, he claimed to be just a man at work. At least one company in the immediate Estama network is owned by 2 former MPs. Medscope Distributors Limited, where Makanga is also a director, is co-owned by Humphrey Kimani Njuguna, who was MP for Gatanga from 2013 to 2017, and is now chair of the Former Members of Parliament Association. On a phone call with one of the reporters, Mr. Kimani denied having any association with Medscope Distributors Limited, but he admitted to being acquainted with Makanga.
Mr. Kimani, are you still a shareholder or a director of Medscope Distributors Limited?
No, I don't even know what those ones are.
Medscope distributors?
You know, and I don't know who those ones are. What's that?
The other owner of Medscope Distributors was Joseph Ngugi Nyomo, an MP from Gatundu South.
The country is mourning the death of Gatundu South Member of Parliament, Joseph Ngugi Nyomo, who collapsed and died on Wednesday morning.
When Nyomo passed away unexpectedly in 2014, Humphrey Njuguna was quoted as the family's spokesman. Mr. Kimani makes a recollection of his relationship with the late MP and Makanga, and the intention they had to get into business together, a venture he claims never saw the light of day.
Do you know Mr. Njagi Makanga or Njagi Makanga Jr.?
Yes, I know him. Njagi Makanga Jr., I know him.
Yeah.
I know him since, I think 2013.
Since 2013?
We are acquaintances.
You're acquaintances? Are you business associates as well?
No. Oh. I am trying to connect. In 2013, 2014.
Yes.
Yeah?
Yes.
With the late MP for
Gatundu South, yes.
Gatundu South, very good friend of mine. We had intended at the time,
yes,
to do some business. That time I was MP for Katanga.
We have no record of Medscope receiving public procurement tenders. But besides Estama, another 8 companies received 19 million for work to prepare and install clinics in slum areas. It is unclear if the two projects are related, but the same day that the Ministry of Health paid Estama for delivering 40 containers from China to Mombasa, these companies were also paid for site preparation and portable clinic installation in 26 locations around Nairobi. They appear in the leaked data to have been paid for the work a week after the non-compete contracts were awarded to them. Reporters tried to reach the 8 companies but were only able to make contact with 4, 2 of which confirmed that they prepared the sites for portable clinics. The other 2 could not provide definitive answers. The other 3 were unreachable and had no online presence. One of the companies, Ocean Bay's Investment, was named in the 1.7 billion shillings Port Ministry scandal in 2018, but has not appeared anywhere since. 2 of the companies that were paid to prepare sites and install portable clinics were Munyoro Investments Limited and Technical Supplies and Services Limited, belonged to Mathira MP Rigathi Gachagua.
Detectives on Monday arrested Mathira Member of Parliament Rigathi Gachagua of alleged embezzlement of public funds.
Gachagua was arrested in November 2020 under suspicion of laundering embezzled public funds, including from the Health Ministry. Technical Supplies is one of the companies listed in the DCI documents. According to the investigation, Gachagua and his wife Dorcas opened an account for the company at Rafiki Microfinance Bank in March 2016. This was 3 months before the Ministry of Health paid for the tender. Gachagua told reporters that he prepared sites for 2 clinics. However, procurement data shows he was paid to install 6. Reporters called officials in the wards to track down the sites where the clinics were supposed to be installed. Local officials from Kangemi, Kosovo, and Pipeline confirmed that the locations had no portable clinics. According to satellite images, majority of the 99 Estama containers appear to have been moved from Miritini sometime between mid-2019 and mid-2020. Interviews with local employees indicated that some were moved to Mtongwe, Mathare, and Shimolatewa. According to Estama's clinics contract, the clinics were destined for Nairobi, Mombasa, and Kisumu. Our reporters called health officials in these counties. In Kisumu, the chair of the Community Services Committee and member of County Assembly, Rashid Miruka, confirmed that 2 portable clinics were received in 2020, but neither are currently functional.
This year, I think we have received 2.
2 portable clinics?
Yes.
Are they fully equipped?
Well, one was taken to Pala in Nyando. Another one is even yet to be opened.
Okay.
It was supposed to be taken to Sangorota, but was transported up to around the main road. Now the road reaching to where it is supposed to be this time is still very bad. We are waiting for the container to carry it.
We were able to spot one of the Kisumu containers with satellite images showing it was moved there between July and September 2020. The County Director for Public Health in Mombasa, Dr. Salma Swale Mohammed, confirmed that they received 2 containers in 2020.
One is at Mwakirunge,
yeah,
and one is at Likoni.
Likoni. Oh, you only received 2?
Yes. The other 2 maybe are still at Shimo. We only received 2.
The containers installed in Mwarukinge and Likoni are not functional, as the county is tendering to get the roofs built. The cost centers for the 2 initiatives are also different. Though we were unable to confirm whether any of the clinics procured by Estama have been distributed in Nairobi, we did track down one at the Mathare Hospital. Another container was spotted in Nakuru County near Naivasha town at Lakeview Primary School. According to a local source, the clinic has never been operational. Satellite images show that it was placed there between March and September 2020. The case against Estama is still being investigated by the EACC. Our reporters were able to identify other contracts paid to these companies or those directly related to them. Those contracts totaled to at least 62.4 million shillings. The services and goods these companies were paid to deliver range from government vehicle repairs, supply of medical equipment, and stationery. As for Beyond Zero, the program has been successfully distanced from anything connected to Estama. We reached out to them, but they declined to comment on the tender transaction, who their supplier is, and their public funding arrangement. But who are the victims? Who could have benefited from these clinics, even at the inflated prices paid to Estama? While some of the available Beyond Zero clinics in Kibera have been useful to some,
Beyond Zero nilijua nikiwa NYS, tulikuwa tunafanya hizo job, ndio zikaletwa hizo ni clinic. Si ndio tulifanya hiyo Beyond Zero ikaletwa juu tulikuwa tunasema sana tunahitaji kitu yenye inaweza tusaidia. Juu sometimes hauna do ya kwenda hosi, unaona inakuwa ngumu, sasa inabidi ukuwe na ile kitu inakusaidia karibu, ndio tukaofa hizo vitu tukaletwa na serikali hizo ma NYS. So mi Beyond Zero birthday kwangu imenisaidia a lot. Juu imekuwa ikitibu watoi wangu, especially mtoi dem alikuwa na ni ya kufaint. Sasa sometimes ya kifaint mimi mkimbiza huko na amenishughulikia sana.
Others remain with more questions than answers.
Tulipoona hii container inakuja hapa, tulishukuru sana. Tulikawakaribisha, maana kuna wale ambao walitolewa hapa walikuwa wanafanya biashara yao, walikuwa wanauza sukuma, walikuwa wanauza mboga. Wengine kulikuwa hata na kinyozi hapa, lakini tulichukua na roho moja tukaona wacha tupeana nafasi walete hii container hapa. Huenda itafika mahali itafanya nini? Itatusaidia sisi kama wenyeji. Tangu ikuje hapa ni muda mrefu sana haijawahi operate. Kuanzia day 1 hadi sasa. Imekaa hapa kwa muda wa miaka mingi na haijawahi fanya. Kwa hivyo huwa tunajiuliza maswali mengi, hata ukiangalia ndani imeshikwa na vumbi.
It's worth noting perhaps that since the first introduction of the mobile and portable clinics in January 2014 and the 800 million shillings paid by the Ministry of Health for portable clinics for slum upgrading, there has been no significant decline in maternal or child mortality. As other African countries such as South Africa and Libya are using mobile clinics to help in the fight against COVID-19, here in Kenya, they remain trapped in a corruption investigation that may ultimately die a quiet death, with no one held to account. All thanks to state capture.
Budgeted corruption has always been there. It's what some call state capture. And when we had fewer institutions of accountability, it was called looting, just simple looting without consequence, when an elite can literally just take public resources and spend them on whatever they want without fear that they will ever be held to account. Unfortunately, it has been a defining characteristic of the Jubilee regime, and very sadly, the health sector has been predated upon more than others